Good morning. Welcome to our briefing for this week, May 7th, 2020. The city is continuing to do business in accordance with the federal and state and guidelines and that provided by the Center for Disease Control and FEMA and other inputs. As of yesterday, we have had a total of 303 positives in the parish and 18 deaths, one up from our last briefing on May the 1st. Our non-essential employees continue to work at home as needed and feasible. Our police and fire departments are essentially continuing to work at full staff, and I'll ask our two public safety chiefs to make some comments at this point. Chief Zagone.
Uh, First off, again, I'd like to say thank you to the first responders that are out there on the front lines, healthcare workers, city employees, everyone. Thanks for all you're doing. Since the last 30-day totals we've had 831 calls for service. We've transported 443 people with a total of 63 of the transports being people that are positive COVID or with possible symptoms of COVID. I'd like to also make a correction from last week's video. The testing that was provided to us was from LSU Health Shreveport. They were the ones that are been so gracious as to allowing us to train us to do testing on our employees and at no charge. And so we were trained to do it. We probably have done 95% of the fire department, offered it to the police department, and done some city employees, probably done about 300 to 400 tests so far. And out of all the tests, we've got most nasal swabs come back within a day or two, and they've all been negative. I brought my own since it's probably covered by HIPAA, but I can show you mine. But it shows you right here, it's a negative test result. These get put in an envelope, passed to the employees. We look at them real fast, make sure there's no positive. If there were, we would address that and send that employee home till they tested negative 2 times before they could return to work. We're waiting on the blood test to come back right now that will give us the antibody, see if anyone has been exposed or has the antibodies to it. Now we're focusing on just the calls for service, as we talked about in the past and what we're doing. Now we're looking at a prep for what it looks like when we do the reopening at some point. We have ordered sneeze glass at all counters in City Hall to where the public would come up and have to address the city for paying a water bill, the marshal's office, permits and inspections, and should have that in hopefully prior to the 15th. And we also purchased some gas backpack sprayers, mosquito sprayers, and the thought process behind that is we'll be able to mix the 1/3 cup of bleach to a gallon of water and be able to sanitize the exterior benches, doors, everything in City Hall, and be able to and let Parks and Rec have a way to disinfect parks and stuff rapidly and effectively. So that's my update for this week. Thank you very much.
Right. Good morning. Thank you, Mayor. Chief Zagone. I'd also like to, as always, echo the chief and the mayor for thanking the first responders and the medical community being on the front line. Once again, I'd like to thank the community for standing up and adhering to the governor's and the presidential orders. It's making it a lot easier on the police department for us to respond to normal calls for service and not have to just effectively or specifically try to handle orders enforcement. As of today, through this whole deal, we have not had any specific incidents where we had to go out and do any type of enforcement as far as social distancing or any business closures or the way they're conducting their business. So I ask everybody to continue their efforts as we get new information coming, hopefully within the next week or the weeks to come, and adhere to the new orders. And hopefully that'll allow us to continue to do openings of business and to continue this effort to get back to a new normal. Thank you.
I'd also like to point out that there are a couple of websites that will provide more information on what we're doing locally. First one is, of course, our Bossier City website, which is bossiercity.org. But just recently, within the communities of Bossier and Caddo parishes, several elected officials, medical personnel, elected officials, as I mentioned, have got together and put out some public service announcements or whatever, and they have established a website that will be intended to help businesses get more information about how we can actually start opening up their respective businesses. And I'll say more about this later on, but that website is opensafesbc.com. opensafesbc.com. Unfortunately, excuse me, the state has not yet met the criteria where we can go into phase one, but we're working it hard. The governor still plans to announce on May the 11th what his intent is on May 15th. Is he must comply with the guidelines that have been provided with regard to a downward trajectory in the number of flu-like cases of COVID-19 positive cases, and there's got to be enough medical facilities and those sorts of things. But we are not there yet, and I think the governor remains cautiously optimistic that we will be able to start moving into phase one on or about May 15th, but not quite sure about that one yet. Some things that I think might be helpful to remind everybody about is exactly what happens when we do go into phase one. There's criteria within the guidelines that are set out for individuals and employers. For individuals, all vulnerable people, and as we all know, that's persons 65 years of age or older with certain diseases like diabetes, overweight, obesity, and things like that, they will continue to shelter in place. And when in public, individuals in public being described as such things as parks, outdoor areas, shopping areas, and so on. At those times, individuals will still have to maintain the no more than 10 people and keep the 6-foot social distances between ourselves. Individuals also will continue to adhere to CDC guidelines about minimize non-essential travel. Employers, I should say, will continue to encourage telework where it's feasible. And then we'll hope to return to work in phases. We'll minimize non-essential training. We'll close common areas, such things as enforcing strict social distancing, where places where people are likely to congregate and interact. And would strongly recommend continuing special accommodations for people who are part of the vulnerable population. Some specific type of employees in phase one that might be of interest to you. One is schools and organized youth activities, such things as daycare camps, will remain closed in phase one. Visit to senior living facilities and hospitals should be prohibited. Large venues, and that's described as sit-down dining, movie theaters, sporting venues, places of worship, can operate under strict physical distancing and protocols. Elective surgeries can resume as clinically appropriate and in the guidance with CMS guidelines. Gyms can be open, but they must strictly adhere to physical distancing and sanitation protocols. Bars would remain closed. So that just gives us some feel for what we would expect if and when, well, I shouldn't say if, when we go to phase one. The governor did announce here recently some changes that we talked about last week And those changes, as a brief reminder, the malls could now, stores within malls could open now, and customers could call in their requests for products, and they would be delivered to the door at the malls. Restaurants could be open with certain limitations. Food can be ordered for curbside pickup, or if there is an outside dining place, they can dine there at the facility, but there can be no table service at those outside facilities. And if there has to be a refill of a drink or something like that, it'll have to be called in and picked up at the door, same as before. But at least restaurants who have that sort of physical layout can do some things that they haven't been able to do in the past. A mask for employees will remain mandatory for people that are serving food, and masks for all citizens, all individuals, is encouraged when outside during this transition period. Just a reminder that the governor has formed a commission to help him, and so has the legislators formed a task force to help provide the guidance to how the state, as a state, would move into phase one. And there is still a little difference of opinion between what the governor requires and what some legislators want. And it's open statewide all at once, or open it parish by parish or regionally contiguous parishes. The legislator did go back into service this past Monday, and I'm sure by the time the governor makes his remarks on May the 11th, we'll have a better feel for which way we're going. I believe that's about all that we can update you on, except what are we here in City Hall doing in preparation for going into phase one. We've taken several significant actions. Chief Zagone has touched on some of the important ones, but I have a few more that I'd just like to share with you what we're doing, so that when the decision is made to go into phase one, what we have done here in City Hall to facilitate a safe and orderly and efficient way to handle it. We've obtained plastic sneeze guards. We've developed one-way traffic or entrance into and out of City Hall. We put 6-foot markers on the floors where appropriate. We've got stanchions and rope barriers for customers to queue them up so that they can efficiently get to the area they need to go, whether it be to pay a water bill or go into city court, and to keep their spacing within those areas that are marked out. We've installed hand sanitizers or made hand sanitizers available in the lobby area. We've obtained face masks for employees. Automatic paper towels dispensers have been installed. The city court has been reconfigured to meet social distancing criteria. WebEx meetings are being used and will be continued. We're encouraging the use of online bill payments. Signage is in place in restaurants to remind people to wash their hands. Hand sanitizers have been issued for police and employees. We have purchased sanitizing equipment that Chief Zagone mentioned earlier. And we, as always, expect our employees to exercise strict social distancing and maintain courteous customer care service. I am very pleased with what I have seen as the response to the directives of the Open America Again guidelines presented by the president. And I want to thank the citizens of Bossier City. This is something we all must do if we're going to get through this thing with the minimum loss of life and reduce the impact, the tremendous economic impact on the businesses that have had to close. We all must do our individual part. You all know what they are. We all know what they are. The washing the hand, the sneezing, the 6-foot separation, the numbers of people, and those sorts of things. So I thank you all for taking this very seriously, and I'm confident that we will come out of this. Louisiana is a state that has dealt with emergencies of all sorts for a long time, and our people come together and do what it takes to get the job done, and we're all doing it, and I thank you, and we'll see you next week.